In the fast-paced world of healthcare, every second counts. Nurses need a systematic and efficient approach to prioritize care. That's where the ABCDE assessment comes in.
This tool helps us rapidly identify and address life-threatening conditions. By following the ABCDE framework, we address the most critical issues first.
Think of the ABCDE assessment as a mental checklist. It guides us through essential steps of evaluating a patient's condition.
This guide will take you through each step of the ABCDE assessment. Let's get started. The airway is the most critical element of the ABCDE assessment. Without a clear airway, a person cannot breathe and will rapidly deteriorate.
Assessing the airway involves checking for any obstructions. Start by looking for obvious signs. Is the patient talking? If they can speak, their airway is likely clear.
Unusual noises like stridor indicate a partially obstructed airway. If unconscious and not breathing, the airway is likely fully obstructed.
Causes can vary from a foreign object like food or a small toy to swelling in the throat caused by an allergic reaction. In trauma patients, blood or broken teeth can obstruct the airway.
If an obstruction is suspected, immediate action is needed. This might involve clearing the airway manually by removing an object.
Once you've established a clear airway, the next step is to assess breathing. This involves evaluating the rate, rhythm, and effort of the patient's respirations.
Count the number of breaths the patient takes in a minute. A normal respiratory rate for an adult at rest is between 12 and 20 breaths per minute. A faster rate could indicate conditions like shock, while a slower rate might suggest opioid overdose or a neurological problem.
Next, observe the rhythm of the breaths. Are they regular or irregular? Irregular breathing patterns, such as Cheney-Stokes respirations, can be a sign of serious medical conditions.
Finally, assess the patient's work of breathing. Are they using accessory muscles in their neck and chest to breathe? Are they gasping for air? Increased work of breathing suggests that the patient is having difficulty getting enough oxygen.
Recognizing abnormal breathing patterns and signs of respiratory distress is crucial for prompt intervention. Interventions may range from supplemental oxygen to assisting with bag valve mask ventilation in severe cases. Section 4. Circulation, the body's highway. Circulation refers to the flow of blood throughout the body, delivering oxygen and nutrients to vital organs.
Assessing circulation involves checking the patient's pulse and blood pressure. Palpate the patient's pulse to assess its rate and strength.
A normal resting heart rate for an adult is between 60 and 100 beats per minute. A rapid pulse, or tachycardia, can indicate conditions like dehydration or shock. A slow pulse, or bradycardia, may be a sign of heart problems.
Measure the patient's blood pressure. Hypertension can be a sign of shock or heart problems. Hypertension increases the risk of heart attack and stroke.
Capillary refill is another quick way to assess circulation. Press on the patient's nail until it turns white. Release and count how long it takes for the color to return. Normal time is less than 2 seconds. Section 5. Disability assessing neurological function. Disability in the context of the ABCDE assessment refers to the patient's level of consciousness and neurological function.
Assessing disability helps us determine if the brain is receiving adequate oxygen and blood flow. This step involves evaluating the patient's alertness, responsiveness to stimuli, and pupil response.
Use the AVPU scale, alert, verbal pain, unresponsive, to assess the patient's level of consciousness. Is the patient alert and oriented to person, place, and time? Do they respond to verbal commands? Do they only respond to pain? Or are they completely unresponsive?
Next, check the patient's pupils. Are they equal in size? Do they constrict in response to light?
Pupil dilation or a lack of pupillary response can indicate serious neurological problems such as brain injury or increased intracranial pressure.
Changes in mental status, such as confusion, lethargy, or unresponsiveness, can be early signs of a deteriorating condition.
Prompt recognition and intervention are crucial for preventing further neurological damage. Section 6. Exposure and Unveiling Hidden Dangers. The final step in the ABCDE assessment is exposure. This step involves visually examining the patient's entire body from head to toe for any obvious injuries or signs of illness that may have been missed in the initial assessment.
Remove the patient's clothing while maintaining privacy and dignity. Look for signs of trauma such as bleeding, wounds, deformities, or bruising. Check for rashes, skin discoloration, or other abnormalities that could indicate a medical condition.
Pay attention to the patient's environment for clues about their condition. While exposing the patient, be mindful of their body temperature.
Use blankets to keep the patient warm, especially in cold environments. Hypothermia can be a serious complication, particularly in trauma patients.
The exposure step allows us to gather additional information about the patient's condition and identify any potential problems that require further investigation and treatment.